Jest dobrze.
We are going to perform a Liften HIFU treatment today in combination with chemical peel procedure and mesotherapy. So you have three different settings. You are switching device on and changing the setting with this button. Setting 1, 2, and 3. Setting 3 would be used for cheeks, for jawline. You can use setting 2 on the forehead, around mouth area, on the neck. Please avoid the middle part of the neck, trachea. Setting 1 you can use on hands if someone has very thin skin on hands, or setting, so it's going to be setting 1 or setting 2. Now for the whole face we are using 700 shots. We do not count in minutes, we're counting in shots performed. So 700 shots in total for the treatment area. You have the counter here, so when you start pressing this button, the shots will be counting down. So one press, one shot. So you can press and let go, or you can just continuously pressing. I prefer this method. You need to move the device around all the time not to cause the skin burn. This I have already applied the gel on the skin. You cannot use the device without ultrasound gel. You can mix it with good quality cream. I mix it very often with Auric Day cream to help to restore the skin barrier. So we're starting with cheeks, 300 shots per one cheek, 150 to 200 per lip area, forehead 100, neck 100 each side. So I'm going to press and hold. Treatment should never be painful. Good HIFU treatment should never be painful. Now I'm using 1.1 joules. So this is the strength. The skin is heated up to 60-70 degrees. 3 millimeter depth, so you're not going to cause any injury, you're not going to injure fat pads or capillaries. You are just stimulating collagen and elastin production. And now you can see I have used already, so I've got 594 shots left. So I'm going to use 300 shot on each cheek. You can let go and start inside with outer face, inside to outer face, inside to outer face. You're moving the device constantly. You are not pointing and keep shooting in the same spot, as you would cause burn to the skin. Your client, your patient can feel heat, but it's not painful. So I have already used 106 shots. You see on indicator straight away how many shots you have left. So when we were using, we've got 700 shots in total. So for one cheek, I'm going to use 300 shots. So I have 400 shots left, so I'm going to continue on the other side of the face. Now, you don't have to perform the full face treatments in every single treatment. You can choose just to treat the mouth area. So you're going to use around 200 shots. You're going to use 200 shots on the neck, so 100 on each side. Or you can just treat the forehead. So you're going to use 100 shots. So we're going to treat the other cheek now. So gel was applied. Now, the patient, the client is not going to feel much, but if you wouldn't use the gel, it would be painful. I'm not encouraging you to try it yourself, but trust me, this is medical grade, Roche approved, FDA approved medical grade HIFU. This cartridge is 3 millimeters depth, working on 3 millimeters depth. You can also purchase additional cartridge, 4.5 millimeters. And with the 4.5 millimeters, you would work on the double chin. You could work on the jawline. You can also work with 3 millimeters on the jawline, but on the jawline, you would work for 4.5, double chin, and some connective tissues area. So maybe you could just perform one line on the connective tissue here and one on the jawline. So on the cheek and on the jawline, but very gently. So 100 shots, 100 shots, and you would use 300 shots on the double chin with 4.5 mm cartridge. Now we're going to perform AMIKO peel. So I'm going to apply pre-peel gel, and I'm going to leave this gel for 2 minutes on the skin. Gel contains AHA acids, BHA acids, and enzymatic extracts. So just 1 milliliter all over the face. That will prepare the skin for the peel penetration. So we removed the pre-peel, and now we're going to apply AMIKO CMCA peel. We're going to leave it on the skin for 3 to 5 minutes depending on the skin type. After 3 minutes, we're applying AMIKO neutralizer, very thin layer. We are just leaving it for 1 to 2 minutes. In this moment, your client might feel that the product is a little bit more spicy. It's because the pH of the skin is changing very quickly. It's rising very quickly. It's all normal. So we're applying neutralizer and we're waiting for 2 minutes. Now we're removing neutralizer with the wet wipe. As you can see, the skin is not reactive. It's just nice and pink. We've got a little bit of erythema. And now I'm going to perform mesotherapy, under eyes treatment, and the lip treatment. So we'll perform mesotherapy. We have disinfected the skin, we have cleansed the skin. I'm going to use alcohol wipe one more time before I start injecting, just under eyes, on the sides and forehead. So this is my treatment area, under eyes, on the sides and forehead. I'm going to use AMIKO Rose Cocktail. So I'm not using more than 0.3 milliliters, under eyes, under each eye 0.33, and the rest of the product on the sides, on the temple, and above eyes. So in total, I'm going to use 1 milliliter of AMIKO Rose. As you can see, I'm just leaving little tiny papules. There's no bleeding. And the forehead, it causes really nice lifting. And just underneath eyebrow. Those little papules are going to be absorbed within 2 to 4 hours. For lip treatment, we're going to use AMIKO Tulip. This is going to rebuild vermilion border. It's going to moisturize lips. As well, I'm leaving little papules. You can use it with microneedling or superficial mesotherapy technique. Now we're going to apply AMIKO Calming Mask, Post-Treatment Mask, Step 3. This mask is going to calm the skin. It contains panthenol, techlorose, and all the anti-inflammatory and calming ingredients. A very thin layer of the gel mask. In the places where we're not performing injection, this mask is amazing post peels, post HIFU treatment, and as part of the facial. And to complete the treatment, we're going to apply Auric Serum, Auric Day Cream, and Auric SPF. So we're completing the treatment with Auric SPF, and as you can see, the skin looks luminous, healthy, without too much of redness or any post-treatment signs. That's it.